Let's start off by talking about, other viruses. You look at Ebola, you look at SARS that we've seen in recent years. Why is the coronavirus spreading so quickly?
If we make, for example, a comparison with SARS, there is a large rate of contagiousness, and so the disease can spread easily. But most importantly, it can spread easily because it can spread also from individuals who are not showing symptoms. And this is something that is extremely important, that differentiates strongly with previous epidemics and also makes it more difficult to control.
I mean, there are questions, from the public. A lot of people ask, transmittable. We know it's highly transmittable, but how is it being transmitted?
It is transmitted like an infectious respiratory disease. So if we make a comparison with, for example, the flu, the way it transmits is along the same way. So we, by talking or coughing, it can be transmitted directly from a person to another one. If it is within, for example, 1 meter, 1.5 meters, it can also be transmitted, for example, if there are some infected saliva after we cough that stays on our hands. And so when we shake hands, that's also another possibility. Or if it can also stay on surfaces. We don't know exactly for how long, but that's also another way of transmission.
So presumably this is one of the questions that scientists are racing to find out. My colleagues and I were speaking today, and we've seen, a lot of people wearing masks, not so much just in Asia, but equally in Europe now. How effective is that, or is it just something to reassure people ultimately?
Masks are recommended for somebody who's either infectious or so already tested positive, or maybe with a suspicion of infection. So it is a protection not for the person itself, but for avoiding that person could transmit the virus to other people. It's not efficient, and that's why it is not recommended for people to protect themselves from other infection. The protection in that case would be to increase the social distance. So really try to avoid contacts or try to avoid places where there is a high density of people.
Now, amid the panic that, has been caused, one might say, over the coronavirus, rightly or wrongly so, there are those who've spoken about, whether globally we're prepared for a pandemic, whether we need to do more to ensure that when things like coronavirus happen, we can act more efficiently.
I think we learned a lot from past epidemics and pandemics. Countries have been preparing with pandemic preparedness plans since after SARS epidemic. But then again, every virus is different. And so especially coronavirus of this type that shows also the possibility of transmission in individuals and not showing symptoms, so not being recognized as ill, that requires additional understanding that we're learning on a day-to-day basis in order to be better prepared to face the epidemic.
Resurgence is one of the questions that has come out of coronavirus. Of course, as scientists try to get a vaccine together, which could yet take some time. The next question, I suppose, will be how we stop this from reoccurring, from coming back once it's ultimately under control.
That is something that we don't know at the moment. We will need several months in order to understand this question and to better answer to it. One thing that we don't know yet is whether a person, for example, after being infected becomes immune, and for how long. This could, for example, a person could become immune for 10 years, or it could be instead on a much shorter scale. So ultimately, the possibility to have a resurgence and a new circulation of the virus will depend on this understanding.
Because, of course, there was recently the woman who was released from hospital having, been cured supposedly of the virus, only to succumb to it again. I mean, that must be a very worrying or interesting case for scientists.
Absolutely. So we are really learning and trying to estimate the length of the infectious period. That is the period during which a person can transmit the disease. And that is the period in which we need to act in order to isolate individuals who can transmit and try to prevent further transmission. But this is something that, once again, being a new virus, there are so many dimensions that we don't know and that we are trying to learn from the data we get.
Just a final question. If there was anything that I know you say we've learned a lot since SARS and equally, since Ebola as well. If there was anything that you think, at this stage could have been done a bit better, perhaps a more rapid response, what would you say?
The epidemic has evolved so rapidly. I think that countries have put in place the recommendation that the WHO has issued. Clearly, the fact that we're seeing, for example, previously unseen chains of transmission in many countries, from Italy, now Germany, also the US, is an indication of the nature of the epidemic, and not so much of the response. It is subtle and very efficient in the transmission, even before we're able to recognize it.
Okay, Vittoria Colizza, you're Director of Research at INSERM. Thank you very much for your time today.
Thank you.